It's a fairly common situation. You're following some program for weight loss, but you just can't seem to lose weight, or it's very, very difficult or very slow. Well, one of the common causes for failure to lose weight are medications. This is very common because it applies to so many different medications, such as beta blockers. Beta blockers are drugs like metoprolol, carvedilol, propranolol. There's a bunch of them. They all end in that OL. And they're prescribed for a variety of different purposes, such as migraine prophylaxis, hypertension, heart rhythm disorders, and some other conditions. Those are very common causes for blocking weight loss and also cause weight gain while you take them. Another common class of drugs that causes either weight gain or blocks weight loss are antidepressants like Elavil, Doxepin, Paxil, Trazodone. Likewise, block weight loss and also can cause weight gain. A variety of anti-inflammatory drugs can block weight loss or cause weight gain, especially Lyrica and prednisone. And prednisone, of course, can cause extravagant weight gain. Lyrica can also cause some pretty substantial weight gain. Some seizure disorders, such as valproic acid, can also block weight loss. Diabetes drugs, especially Actos, Avandia, and insulin. Insulin is an incredibly potent weight gain drug. I've seen this happen numerous times. Someone has type 2 diabetes, it's getting worse and worse and worse because you're told to eat lots of carbs and cut your fat, right? Lots of grains. And you gain all this weight, you have to go on insulin. And the first year you take insulin, you gain 30 to 50 pounds because insulin is the hormone of fat storage. So you're given a drug to help reduce blood sugars that causes extravagant weight gain. So it's very difficult, perhaps impossible, to lose weight while taking insulin. Lastly, antihistamines, drugs that are common and so widely taken as antihistamines, whether they're prescription or over-the-counter, can block weight loss or cause a modest weight gain. Now, unfortunately, don't expect your doctor to always know these things. In fact, they'll often say to you, no, it doesn't. All you have to do is tell them, look in the PDR, the physician's desk reference. Every doctor's office has a big, thick book that contains all the side effects and interactions of prescription drugs called the PDR. And it's in there. All these are listed in the PDR as well as in clinical trials and the literature provided by the drug companies, because we know these drugs cause weight gain or block weight loss because the drug companies tested for it. And this is established fact, even though your doctor often won't know that. Nonetheless, first place to go, if you're on one of these drugs and it's blocking your weight loss, you believe, talk to your doctor about getting off of them, maybe replacing it with a drug that doesn't cause weight loss. So for instance, if you're on a beta blocker like metoprolol for hypertension, maybe an ACE inhibitor or an ARB, angiotensin receptor blocker, could be replaced. But even better than that is eliminate the need for these kinds of medications in the first place. How do you do that? You correct the common factors that allow these conditions that lead to these prescription drugs or these drugs in the first place. So for instance, if you become a non-diabetic, you don't need the insulin, right? Or the Actos or the Avandia. So get rid of these conditions. How do you do that? That's one of the primary purposes of the Wheat Belly and Undoctored programs. We try to correct the factors that allow conditions like diabetes or allergies or hypertension or migraine headaches to emerge in the first place. That's the best way to get off these drugs. Not everybody can get off these drugs. There are selected situations where you simply can't, but the vast majority of people can correct the situation, the factors that lead to these conditions in the first place that lead to these drugs. So it is entirely possible for the majority of you watching this to get off these drugs and be healthier off the drugs.